have Kate Basedow, who is a licensed veterinary technician.
One of the best things to do is pre-anesthetic blood work. Give them a bath before surgery. Ask about an estimate for the procedure ahead of time. Ask about the drop-off time ahead of time. Stick with the normal dog food.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
What you do before your dog goes in for surgery can have a huge impact. It can make the day go smoother, it makes it easier on your dog, and you may even get better outcomes. Stay tuned for essential tips and expert insights. Hello, I'm Molly Jacobson, editor-in-chief over at dogcancer.com, where over 40 veterinarians, veterinary oncologists, cancer researchers, and science writers like me pull together to bring you better information today so you have no regrets tomorrow. This video is the first in a 3-part series on surgery for dogs. We're going to cover everything you need to know before, during, and after. This video covers what you can do at home to prepare your dog for surgery. The next video will cover what you can do on the day of surgery to help your dog sail through their experience. And in the third video, we'll talk about how to care for your dog in the days and weeks after surgery. To get you all of the best and most helpful tips, our intrepid host, James Jacobson, is joined by veterinary technician Kate Basedow. Kate has been helping her mother, who is a veterinarian, with their hobby farm and all the animals on it since she was a toddler, and she grew up to be a fantastic writer and also a licensed veterinary technician in her own right. So she has a lot of experience, a lot of insights, and a lot of really inside tips that will help you prepare your dog for surgery. Which reminds me, if you find this content helpful, please help us help other dog lovers. Dog lovers far in the future who don't know yet that they need this information will find it easier if you feed the algorithm. Like, subscribe, leave a comment with a question or your thoughts or your own tips. That will be really helpful. It will help us reach more dog lovers who need to know how to prepare their dogs for surgery. And now let's go ahead and listen in to the conversation between James Jacobson and Kate Basedow.
Kate, first of all, welcome.
Thank you. I'm happy to be here.
It's great to have you. So what are some of your tips and suggestions on how people can prepare for the best outcome?
One of the best things to do is pre-anesthetic blood work. Blood work can be expensive. Sometimes it can be like, well, my dog's young and healthy and everything's fine. I don't really want to spend this money, but it's nice to have that information because when your dog does go under anesthesia, the anesthesia drugs are processed by the liver and kidneys. So if we can do that blood work ahead of time and know if there's any problems with the liver or the kidneys, the veterinary team can change up their drug protocols to make it a little easier on your dog, or they can start giving IV fluids earlier instead of just running them while the dog is under anesthesia to help with hydration to support the kidneys. You don't start seeing clinical signs of kidney failure until 75% of the kidneys are gone and not salvageable anymore. So doing blood work ahead of time to say, okay, the liver and or the kidneys are looking a little funky can help with making decisions like, should we just change up our drug protocol or should we postpone this procedure and get the dog started on some sort of liver support or kidney support medication to address the problem and then come back to surgery. Most veterinarians will let you do the blood work up to a month in advance. If your dog is having some problems, and definitely for cancer patients, they're probably going to want the blood work to be a little closer to surgery just to make sure that the information is as accurate as possible. If you've got a furry dog or a dog who likes to get dirty, give them a bath before surgery. This is something that people a lot of times don't think about because you're just focused on the procedure and you're worried about that. And then your dog comes home and the technician is telling you that they can't have a bath for the next 2 weeks. And you're like, oh my God, I'm stuck with this stinky dog for 2 weeks. So
that sounds like a lesson.
Surgery.
That sounds like a hard-learned lesson.
Thankfully, I haven't had to deal with that, but I've definitely had clients look at me like, what do you mean I can't give them a bath? Another thing is to buy a cone or an Elizabethan collar, the cone of shame, or a bodysuit intended to protect the incision ahead of time so that you know you have something in hand that can protect your dog's incision after the surgery, and you know it already fits well. Acclimation beforehand would definitely be the kinder thing. Get out your treats, have them wear the cone a little bit or put the bodysuit on and tell them how perfect they are, give them some treats, make it a normal sort of thing for them.
Do you have some recommendations for, because I've seen like the inflatable ones and I've seen all sorts of things. Do you have some thoughts on that?
Personally, I don't trust the inflatable donut ones. My dogs have very long noses, and I would be concerned that they could reach around and still get at the incision. So I tend to stick with a standard plastic cone, or for some dogs, just a plain t-shirt will work, especially if it's an incision like kind of on the shoulders or the neck. A t-shirt or a turtleneck can cover the area and provide adequate protection.
We will put some links in the show notes to some bodysuits that may be appropriate and some of Kate's other picks, and those are in the show notes. So what are some other tips, Kate?
Ask about an estimate for the procedure ahead of time. Take it with a grain of salt, because often we don't know exactly, especially with a surgery to remove a lump or a tumor, we don't know exactly how involved the procedure is going to be until we get in there. So that's why they give you a range, but usually they're pretty good at eyeballing how much something is going to cost.
Because time is money. So if they go in and then decide or see that there's a lot more to do, it takes longer in surgery, which is more of the veterinarian's time and more of if there's a anesthesiologist or a vet nurse who's going along with it. It's just going to take longer and therefore cost more.
Yep, exactly. Some lipomas, fatty tumors, are encapsulated, and those, when the veterinarian opens it up the area with the incision, they literally just pop out. It's super quick and easy. Just pop it out, sew the dog up, everything's great. But if the tumor is more diffuse and attached to tissues underneath, it can take a while to parse out and get that out of there. Ask about the drop-off time ahead of time and if the dog will need to stay overnight. For most routine procedures at most clinics, they'll send the dog home the same day, usually toward the end of the day. But sometimes for more involved procedures, or if something goes wrong, they might want to keep your dog overnight for observation to make sure everything's okay. That can also happen if the incision's in an area that's really fragile. Like any incision over a joint where motion could potentially open the stitches, the surgeon might want to keep your dog overnight just to be sure that they're staying still and quiet and to address any problems that might arise immediately. Also ask if they want you to give any medications that your dog is on the morning of the surgery or not. Sometimes some medications they will want you to give, others they'll want you to wait and just bring with you at the time of drop-off. Another important thing to think about, which is hard for all of us, is about whether or not you want life-saving measures done if your dog goes into cardiac arrest. Most veterinary hospitals will have some sort of DNR, do not resuscitate form, where they will ask you if they want your dog to be resuscitated and to get CPR, or if you would prefer to just let the dog go if they head out.
Is this DNR part of all that paperwork? Because oftentimes when you go to the vet for surgery, there's like this ream of paper. Sign here, and you're literally signing things. And I'm sure we all are, astute lawyers who know never sign anything until you've read it. But I think sometimes in the heat of the moment, whatever, you're just signing. Is that DNR contained in that, or is it a separate agreement usually?
It'll depend on the clinic. Usually it's in that stack that they're handing you, whether it's on its own page or built into everything might vary. You can also ask for that surgery paperwork ahead of time. I know we loved it when people would show up on the morning of their surgery with their surgery paperwork already filled out. It streamlines the drop-off process and gives the owner time to really read through and understand everything, or to note places where they have questions for us. So on the night before the surgery, you'll want to feed your dog dinner at its normal time. Resist the temptation to give a special last meal. Just stick to where I know I feel the same way. I always want to give my dog something. But if you give that cheeseburger or that pork chop, your dog could potentially get diarrhea or start vomiting. And those sorts of things could mean the surgery has to be postponed, or that your dog has a little rougher time the next day. So resist the temptation, stick with the normal dog food.
That's great advice.
Give the normal evening medications. Ask your veterinary staff ahead, and usually they'll call you a day or two before the surgery, both to confirm your appointment and to go over the exact details. But most of them will want you to withhold food for 12 to 24 hours before the surgery. Well, that's because sometimes dogs, when they're under anesthesia, will throw up or either vomit or regurgitate. And if there's food in the stomach, that food or liquid could potentially be vomited up into the mouth and then go down the trachea into the lungs. And you don't want your dog to aspirate food or water. Another note on the food is to make sure that everyone in the family is on the same page about when your dog is allowed to have food or not before surgery. So you don't want Uncle Fred walking in at 2 a.m. and giving the dog a hot dog.
Great advice. So Uncle Fred, no hot dogs. Well, this is awesome. A lot of really useful tips. And our series continues on the next episode, where Kate will walk us through tips for the day of surgery. Kate Basedow, thank you so much for being with us today.
You are very welcome. Thank you.
There are can't miss links in the video description, so make sure to take a look at that. And otherwise, we just hope that this conversation and Kate's insights and tips has really helped you feel more confident in preparing your dog for surgery. Don't forget to like and subscribe, leave a comment, and I'll see you soon at dogcancer.com, where we're there for you for support and better information today, so you have no regrets tomorrow. See you soon.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.